What really happens to your body when you go 6 months without sex? Is it harmless? Is it dangerous? And what does it mean for your testosterone, your prostate, your heart, and your confidence? I know this isn't the kind of question most men ask their doctor, but in my exam room, behind closed doors, it comes up more than you'd ever expect. Men in their 60s, 70s, widowed, separated, in long-term relationships that have gone quiet, all asking the same thing with the same look on their face. Am I doing damage? Is something going wrong inside? Gentlemen, today we are answering that question completely, and I promise you, some of what I'm about to share will genuinely surprise you. Because the science here is far more interesting and far more personal than you've been told. And stay with me, because point number 5 is the one that changes how every man in this situation thinks about his body going forward. I'm Dr. Amanda, a urologist with 12 years of experience helping men over 60 reclaim their vitality, strength, and confidence. I've worked with thousands of men who thought their best days were behind them. Men who sat in my office too embarrassed to ask the most basic questions about their own bodies. My job is to change that. No judgment, no shame, just science, honesty, and practical solutions. That's what you're going to get today. Before we get into it, hit that like button right now. It takes 1 second and it helps this video reach the men who need it most. And drop a comment below telling me where you're watching from. Are you in Texas, Australia, the UK? I read every single comment, and you'd be amazed how many men around the world are sitting with the exact same question you have today. All right, let's talk about what's really happening inside your body. Here's the truth that most men over 60 are living with but not talking about. Sexual inactivity is far more common than anyone admits, and it carries real physiological consequences that your doctor has probably never mentioned. Let me paint 3 pictures for you. First, the circulation picture. Sexual activity, including solo activity, is a cardiovascular workout for your pelvic region. It drives blood flow to the erectile tissue, exercises the smooth muscle inside the penis, and stimulates the vascular network that keeps that tissue healthy and responsive. When that stimulation stops, for weeks, then months, that tissue begins a process called smooth muscle fibrosis. Think of it like a rubber band left in a drawer. Unused, unstretched, it slowly loses its elasticity. The tissue that should be supple and responsive begins to stiffen in exactly the wrong way. Second, the hormonal picture. Sexual activity, particularly orgasm, triggers a cascade of hormonal releases: dopamine, oxytocin, testosterone. These aren't just feel-good chemicals. They are biological signals that tell your body, this system is active, maintain it, prioritize it. When those signals go quiet for 6 months, your brain begins to downregulate. Testosterone production can dip. The hormonal feedback loop that keeps your drive alive starts to idle, and an idling engine, left long enough, becomes harder to restart. Third, the psychological picture. This is the one men least expect, and it hits the hardest. Sexual confidence is not just about performance. It's about identity, about feeling like a vital, capable man. When that part of life goes quiet, whether by circumstance, loss, or relationship changes, something deeper starts to shift. Men begin to tell themselves a story. That chapter is over, that they are past it. And once that story takes root, it becomes a self-fulfilling prophecy that has nothing to do with their actual biology. The good news? Every single one of these processes is reversible, and that's exactly what we're going to talk about right now. Inside the penis are 2 cylindrical chambers called the corpora cavernosa. These chambers are filled with smooth muscle tissue and a network of blood vessels. When aroused, blood rushes in, the smooth muscle relaxes, and an erection occurs. This tissue requires regular oxygenation to stay healthy. During erections, including the natural nocturnal erections that occur during deep sleep, fresh, oxygenated blood cycles through this tissue and keeps it supple. Studies have shown that men who go extended periods without sexual activity or erections experience measurable changes in penile tissue oxygenation. Over time, collagen can replace smooth muscle cells, and collagen doesn't stretch. This is the physiological foundation of what's called disuse atrophy. Here's why this matters beyond the biology. Men who experience a long period of inactivity and then attempt to return to sexual activity often find that things don't respond the way they expect. And when that happens, they panic. They assume something is permanently wrong. They pull back further. The shame compounds. And what was a temporary, correctable physiological shift becomes a psychological wall. I have seen this pattern dozens of times. The body wasn't broken, but the man had convinced himself it was. The solution here is consistent stimulation, whether with a partner or independently. From a urological standpoint, regular erections are maintenance. They are not optional for men who want to preserve erectile function as they age. If you are going through a period of inactivity, I recommend what I call a vascular maintenance routine. At minimum 3 to 4 times per week, stimulate arousal to the point of erection for at least several minutes. This cycles oxygenated blood through the tissue and signals to your body that this system is still in use. You can also support tissue health with daily L-arginine supplementation, 3 to 5 grams, which is a direct precursor to nitric oxide, the molecule that enables erections. Testosterone is regulated by a feedback loop involving the hypothalamus, the pituitary gland, and the testes, what we call the HPT axis. Sexual activity and orgasm have been shown in multiple studies to influence this axis. One landmark study found that men who had sexual intercourse had measurably higher testosterone levels in the 24 hours following compared to men who did not. The mechanism involves prolactin regulation, dopamine signaling, and direct stimulation of the Leydig cells in the testes. When this system goes unstimulated for months, output doesn't stop, but it does dial down. Combined with the natural 1% annual testosterone decline after age 30, a 6-month period of inactivity in a man over 60 can create a noticeable hormonal shift. What does lower testosterone actually feel like? It's not always dramatic. It's subtle. It's the flatness, the reduced motivation, the way you used to feel a spark for things, for your work, your hobbies, your relationship, and now that spark is quieter. Men describe it as feeling like they're watching life through a window instead of living it. And because it happens gradually, most men don't connect it to their sexual health. They just think they're getting old. They're not. They're getting depleted, and there's a difference. Beyond sexual activity, here is what you can do right now to support your testosterone axis. First, resistance training, 3 times a week minimum. Compound movements, squats, deadlifts, rows, are the most potent natural testosterone stimulators available. Second, optimize your vitamin D levels. Get tested. Most men over 60 are deficient, and vitamin D is a direct cofactor in testosterone synthesis. Target 50 to 70 nanograms per milliliter. Third, prioritize deep sleep, 7 to 8 hours, because 70% of your daily testosterone is produced during sleep. And fourth, reduce alcohol. Even moderate drinking suppresses testosterone significantly. 2 drinks a night for a week can drop testosterone levels by up to 20%. Robert, 68, came to see me 8 months after his wife of 41 years passed away. He was grieving, as you'd expect, but what he told me quietly at the end of the appointment was this: "Dr. Amanda, I feel like I've become invisible, like I'm not even a man anymore." He wasn't talking about performance. He was talking about identity. After working together on a structured wellness protocol, exercise, nutrition, testosterone support, and honest conversations about what normal looked like for a man in his situation, 6 months later, he came back. He sat differently. He looked at me differently. He said, "I forgot that feeling. I thought I'd lost it." He hadn't lost it. He'd just stopped feeding it. This is the one that surprises most men. The prostate gland produces a significant portion of seminal fluid, and regular ejaculation helps flush the glandular ducts and prevent stagnation of prostatic fluid. A landmark Harvard study that followed nearly 32,000 men found that those who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer, compared to men who ejaculated 4 to 7 times per month. While correlation is not causation, the proposed mechanism is straightforward. Regular flushing of the prostate ducts may reduce the accumulation of carcinogens and inflammatory compounds. A 6-month period of complete inactivity represents a significant disruption to this natural maintenance cycle. I want to be careful here not to create fear, because that is the opposite of what I want you to feel. But I do want you to understand that your prostate health is not passive. It is not something that just happens to you. It is something you actively maintain. And one of the most natural, accessible ways to support it is through regular ejaculation. When I explain this to my patients, I watch something shift in them. Suddenly, taking care of that part of their health doesn't feel embarrassing. It feels responsible. The practical takeaway is simple. Aim for a minimum of 2 to 4 ejaculations per week, regardless of whether a partner is involved. This is not about pleasure, though that matters too. This is about prostate maintenance. If you are over 60, make sure you are also getting your PSA levels checked annually and having a prostate exam as part of your regular care. And if you have urinary symptoms, hesitancy, weak stream, nighttime urination, please bring those to your doctor, as they can indicate prostate changes that need attention. Quick pause before we continue. I want to acknowledge something. Some of you watching this are not in a period of inactivity by choice. You're widowed, you're separated, your relationship has changed, and watching a video like this can bring up a lot of emotions alongside the information. I see you. And I want you to know everything I'm sharing today applies to you, wherever you are. Taking care of your body during a difficult chapter of life is not disloyal, not inappropriate, and not selfish. It is simply good health. Okay, let's keep going because point 5 is the one I really want you to hear. Sexual activity triggers the release of oxytocin, dopamine, and endorphins, 3 of the most powerful mood-regulating neurochemicals in the brain. Oxytocin reduces cortisol and anxiety. Dopamine reinforces motivation and reward-seeking behavior. Endorphins create physical well-being. When these chemical releases stop for an extended period, the neurological baseline shifts. Studies have linked prolonged sexual inactivity in older men with increased rates of depression, social withdrawal, and cognitive decline. This isn't coincidence, it's chemistry. Here is what I see clinically. Men who go through extended periods of sexual inactivity don't just feel less desire, they feel less, full stop, less engaged, less present, less like themselves. And because our culture doesn't give men permission to talk about this, because it feels weak or embarrassing or irrelevant at their age, they carry it alone. They shrink. And a man who is shrinking is not a man who is aging. He is a man who has stopped fighting. And that is the one thing I will never accept for my patients. 3 specific steps. First, social connection. Loneliness is one of the most powerful suppressors of sexual health and overall vitality. Prioritize time with friends, family, community. Second, consider speaking with a therapist or men's health counselor, particularly if your inactivity is tied to grief or relationship changes. There is no shame in getting support. It is the strongest thing you can do. Third, physical touch, even non-sexual, matters enormously. Regular massage, physical closeness with people you trust, even pets. These stimulate oxytocin and keep the neurochemical baseline healthier. This is the point most men never hear, and it is the one I most want you to remember. After a prolonged period of inactivity, the body needs a recalibration period. Erectile response may be slower. Sensitivity may be different. Ejaculation timing may change. This is not dysfunction. This is physiology. The smooth muscle needs to be reconditioned. The vascular response needs to be reawakened. The hormonal and neurological signals need to sync back up. Think of it like returning to the gym after 6 months away. Your first session is not your peak performance. It's the beginning of the return. This point matters so deeply because men who don't know this, who return to sexual activity after a long absence and find that things aren't immediately the way they remember, often conclude the worst. They think something is permanently broken. They withdraw. They stop trying. And what was a normal, temporary physiological recalibration becomes a permanent retreat. I have seen this happen to wonderful, vital men who had no idea that what they were experiencing was completely normal. The knowledge that it's normal changes everything. Here is your recalibration protocol. For the first 2 to 4 weeks of resumed activity, reduce performance pressure entirely. Focus on sensation, connection, and physical presence rather than outcome. Communicate with your partner if you have one. Honesty removes pressure. Take PDE5 inhibitors if prescribed by your doctor, not as a permanent solution, but as a bridge medication that supports the vascular recalibration process. Continue your L-arginine supplementation, resistance training, and sleep optimization. Give your body 4 to 6 weeks before you evaluate where you are. You will be surprised. Michael, 72, had been a widower for 2 years when he met someone. He came to see me before their relationship became intimate because, as he put it, "I want to be ready, doc. I don't want to embarrass myself." We put a recalibration plan in place, 6 weeks of vascular support, pelvic floor work, hormonal optimization. When he came back 3 months later, he was beaming. He said, "I was so afraid. I thought that part of my life was just a memory. I had no idea my body still had this in it." He was 72, and he was starting over. That is not an exception. That is what is possible. All right, gentlemen, here is your simple action plan. Write this down. Step 1, implement vascular maintenance. 3 to 4 times per week minimum. Erections need regular blood flow to stay healthy. Supplement with L-arginine, 3 to 5 grams daily to support nitric oxide production. Step 2, optimize your testosterone axis. Resistance training 3 times per week. Get your vitamin D tested and supplemented. Protect your deep sleep. Reduce alcohol to no more than 1 drink daily. Step 3, support your prostate. Aim for 2 to 4 ejaculations weekly. Schedule your annual PSA check and prostate exam if you haven't had one this year. Step 4, protect your mental baseline. Prioritize social connection, consider counseling if you're navigating loss or transition, and give yourself permission to tend to this part of your health without shame. That is it. 4 steps, 30 days. Come back and tell me what changed. Before I let you go, I want to speak to you directly. If you've been carrying this quietly, if you felt frustrated or embarrassed or secretly afraid that this part of your life is simply over, I want you to hear this clearly. You are not broken. You are not past your time. You are not a lesser version of yourself. Your body is doing exactly what a body does when it isn't being maintained. It's waiting for the signal that you still want to live fully. And the moment you give it that signal, through movement, through nutrition, through knowledge, through action, it responds. I have seen men in their 70s and 80s restore what they thought was lost forever. Not through magic, not through expensive procedures, through understanding their biology and refusing to accept the story that their best days are behind them. After 60, you are not declining. You are experienced. And experience combined with the right support is unstoppable. If this video gave you something today, if it answered a question you've been carrying around and didn't know how to ask, please hit that like button right now. It genuinely helps this information reach other men who need it. And drop a comment below. Tell me, which of these 5 points hit closest to home for you? Was it the tissue health, the testosterone, the prostate, or point 5, the return? I want to know. I read every comment. If you have a friend, a brother, a father, or a husband who might need to hear this, share this video with them. You might be giving them something more important than you realize. And subscribe if you haven't. I post every week with practical, honest, research-backed content for men who refuse to just accept decline. I'm Dr. Amanda, reminding you that after 50, vitality isn't lost. It's waiting to be awakened. Take care of yourself, gentlemen, and I'll see you in the next one.